In this candid and inspiring conversation, my guest shares how grief, faith, and courage have shaped both her life and her public health leadership. From navigating the sudden loss of her brother to finding her voice as an evaluator and entrepreneur, she reflects on what it means to turn pain into purpose and to lead with both heart and vision. She invites us into her journey of healing and transformation, stepping beyond comfort zones, claiming her multifaceted identity, and building a consulting practice rooted in equity and community impact. With honesty and hope, she reminds us that purpose often emerges from our deepest challenges and that prioritizing wellness is itself a radical act of leadership. You're listening to the Courageous Public Health Podcast, episode 20. To all the courageous Black, Indigenous, and women of color leading in public health, this podcast is your space to turn up the volume on your courage. This space centers your voice. This space celebrates your passion. This space amplifies your courage. My role? To listen, to amplify, and to stand with you in the fight for equity. My name is Dr. Christy McClamrock. I'm an epidemiologist, consultant, the founder and CEO of Courageous Public Health, and the host of the Courageous Public Health Podcast. Each week, I have unfiltered conversations with BIPOC women in public health about the challenges you face, the power you hold, and your vision for the future. We talk about the authenticity, vulnerability, and courage that you bring, not just to public health, but to every part of your lives. Because courage is about action, even in fear. It's about taking up space, leading unapologetically, refusing to be erased, and knowing you never have to do it alone. If you're ready to turn up the volume on your courage, if you're ready to take up space, if you're ready to smash the racist, patriarchal, cisnormative, heteronormative, ableist, capitalistic systems, then let's dive into this brand new episode. Thank you for joining me on this episode. I'd like to start by introducing myself if you're brand new to the podcast, or reintroducing myself if you're a returning listener. My name is Dr. Christy McClamrock, and I am the CEO of the Courageous Public Health Consulting Firm, where we support public health organizations through workshop design and facilitation and speaking engagements. I am so excited to introduce you to my guest on this episode. Let me formally introduce her, and then we'll jump right into our conversation. Simone McPherson is a powerhouse public health scientist, evaluation and research consultant, and kingdom-minded entrepreneur on a mission to ignite change and transform communities. With over a decade of experience across federal, state, local, and community levels, she has led and supported the evaluation of diverse public health initiatives from national programs to grassroots efforts. Simone's expertise spans the development of health equity frameworks, mixed methods research, qualitative and quantitative analysis, and turning complex findings into actionable insights that shape policy and improve health outcomes. But her story goes beyond the credentials. Simone's journey began with a simple question: how can we use health information to truly make people's lives better? That question has fueled her to launch with purpose, Women Impacting Nations Consulting, LLC, or WIN Consulting, a woman-owned public health evaluation and research firm that helps mission-driven organizations elevate community voices, design impactful programs, and tell powerful stories through data. Grounded in integrity, intention, and a bold commitment to justice, Simone brings the courage to lead with both purpose and precision by transforming strategy into healing and data into real-world solutions. Let's connect my conversation with Simone McPherson right now. Hi, Simone. It's so good to have you.
Hey, so good to be reconnected and see you.
Oh my gosh. I'm so happy. I'm so happy to reconnect with you. We're in touch for a couple years, but has it been a couple years?
Like
maybe a year and a half or so. The way
year and
time
a
is
half?
flying, I don't know.
Time is
Sometimes
flying.
it feels like a many years, and sometimes it's just only a couple of months.
I know. I totally get it. I totally get it. But anyway, it's like I'm really excited to have you here. I'm excited for this interview. Yeah. So I want to start by giving you a chance to introduce yourself.
Awesome. Thank you so much. And again, thank you for the opportunity to be on your podcast. Yes, I'm Simone McPherson, a public health scientist and evaluation research consultant. I've been doing my thing for over a decade now. My experience is in program evaluation, applied research, public health strategy, all things chronic disease, data, health promotion. I'm a big on health equity and community engagement. Like those are my passions. I have experience across federal, state, local government, as well as with community-based organizations and programs. And my expertise lies in implementation of evaluation and equity frameworks, mixed method research, data analysis, and as well as just taking findings and making sure that it informs policy and improves health outcomes. Like, what does this information mean? And taking actionable insights. Another thing about me is I'm also a CEO and founder. I recently fully launched my evaluation and research consulting firm. It is called Women Impacting Nations, also known as WIN Consulting for short, and it's a woman-owned consulting firm. And our mission and vision is really helping mission-driven organizations to use data to ignite change and transform communities into living full and healthier lives.
Oh my gosh, WIN Consulting. That's like the best name. I love that name so much.
Thank you.
Nice.
Thank you so much.
Good use of acronym. Very, very cool.
Yes.
And I love that you talked about actionable insights, like using data to have actionable insights. That is, that really resonates with me as an epidemiologist, and that, you know, it's not just the data, right? The data is a means to an end.
Exactly.
Yeah. So I want to jump right in because I feel like we have a lot to talk about, which is very exciting. So let's start with the first question. So I like to remind our listeners about the difference between bravery and courage, that bravery is taking action without fear, while courage is taking action despite fear. And so I would love for you to share some experiences from your professional life, from your personal life, where you have acted courageously. And I know there are many.
Yes. So first and foremost, I want to say I love your podcast. And I was like, this is the perfect space. Because when I say courage is like a daily thing, I can only speak for myself. Okay, courage is daily for me, right? And one of my life scriptures, I'm also a person of faith. I'm a believer. And one of my life scriptures is Joshua 1:9. And it's, have I not commanded you, be strong and courageous. Do not be afraid. Do not be discouraged, for the Lord your God will be with you wherever you go. And I want to get that tattooed on me one day.
Yes.
To be strong and be courageous somewhere in my body, because I feel like my life has operated in being courageous daily, right? And courage to me is like, I describe it as like a rubber band. Like my life has been a rubber band. Like it's like a stretching. And every time I feel like I've reached that point where I'm like, I think I got this. I've been brave. I've been bold. And it's like, nope. God is like, you got more. Pull more. And you're never going to snap, but I'm going to keep pulling. And it's been that stretch for me. So the first thing I can think of mine, of the many moments in my life where I'm like, Lord, I'm not trying to be your strongest soldier, but here I am, is a personal story for me of just like navigating grief and loss, right? So one thing I want to start off with saying is like, being in public health, sometimes people forget we're part of the public health and we are the community. Yes. So I too have faced systemic barriers. I too have faced, my family, I have faced injustices. And we are the community, right? And I've faced feeling unheard by healthcare providers. My family has faced medical mistrust and trauma, right? So my grief story is I've lost many family members, three in particular, my brothers, my siblings, right? I've lost my great grandmother, I've lost aunts, and many family members in the last 6 years, right? And one story I do want to share with you, one of my brothers, Rob, call him Little Rob R3, right? He lost his life at the age of 21. Very unexpected, very tragically, right? And something that we did not think that would happen, right? He was ill one day, taken to a local hospital. We thought it was food poisoning at the time. And within days, he went from cardiac arrest to being unconscious to having immediate surgery to pronounced brain dead within days, right? So one day being healthy, one day thriving, doing well, having plans for his music, having plans for working, and just a young man, right? Only 21 to having to plan a funeral and navigate life without my sibling, right? And navigating the loss and trauma that it deals with my parents going through that and my other siblings going through the grief and those things. And that was about 6 years ago, right? And I'm still learning how to deal with that, still learning to even how to talk about that. I was just thinking about earlier, like, this is my first time publicly talking about this. So me operating in courage is being on this podcast, publicly talking about that experience, right? Because
I'm getting chills. Like, I literally they just like crept up my body. That's really powerful.
Yeah. And it takes courage to even talk about this, because there was moments and times where I didn't feel safe to share it, or I couldn't get through the story without breakdown and crying, right? So I am proud of myself and patting myself on the back to be able to even share this. And why I do want to share that is because a lot of people face that. We're all going to face loss of someone at some point in time. When it's either expected or unexpected, you're still going to have that journey of grief and loss and losing either a parent, God forbid a child, God forbid a sibling, but we all have to go down that road. And how do you show up when you deal with that, right? How do you continue to have the courage and power to talk about that? And for me, my courage and power is to raise awareness, because he passed due to medical negligence. So my family had to also go through a legal aspect of that as well. And that causes trauma and triggering of that, in a sense of you're already dealing with the loss and having to bury your son and navigate life without him, a piece of a puzzle of a family where we thought we had a future with him, to now dealing with the legal aspects of having to fight for the injustices of the medical doctors and providers who didn't do their job, right? And also navigating this as a sibling of like, wow, I'm in public health and I couldn't help my brother. So dealing with that somewhat of a burden or even guilt of like, I'm educated, I got these degrees, my family, we have health insurance, all educated people, we check all the boxes of what you're supposed to strive for. And yet it still wasn't enough for him to get the care, to feel heard, and to be able to be here till this day, because he should still be here till this day, right? So I wanted to share that story, to raise awareness of that. And my life mission is to do work around that, to raise awareness about medical negligence, of misdiagnoses, especially in Black and Brown communities, especially of folks who are coming in, explaining their symptoms, explaining their issues, and not feeling heard, and being misdiagnosed or not directed into the right treatment and preventive care that they need to live an optimal and healthy life. And I'm still trying to navigate that, Christy, of like what that looks like through my business and consulting and my working community. But I really want to do some work around that. So that is one of my story of like taking my experience and my journey of grief and loss, and how do I turn my pain into purpose, and the tragedy my family faced into transformation for other families, so they do not have to go through that.
I think the idea of an experience like that, then as a public health professional, you have to kind of come to terms with what does that mean about your own identity as a public health professional? That, yeah, I mean, I'm sure a lot of people can relate to that, right? And whether it's loss of a loved one or any other kind of traumatic experience, it can kind of shake your identity and make you think, well, what does this mean about me?
Absolutely,
Yeah.
absolutely. And being okay to know that healing is a process and it takes time. And, there's some folks who deal with that and they're like, ooh, I'm going to open up this nonprofit and I'm just going to be out there advocating for this. But the reality is not a lot of folks are able to do that or even want to talk about that. And that's another whole other issue, especially in our Black and brown communities, of like dealing with stuff of this resilience and faithing our way through it and not talking about it, dealing with so many traumatic things and just like, oh, that was crazy. All right, well, we just gonna pray and our faith our way through it and move on. And it's like, no, that is not something we can just move on with. It takes time, it takes therapy, it takes having conversations like this. Like I was mentioning to you earlier, this is part of my healing process of talking about it. Before I could not even talk about and go through a sentence without breaking down. So like, this is part of my healing journey, right? And to raise awareness, but to also just even have this conversation, because so many people have gone through this and don't talk about it and just are expected to continue life like it's normal.
Yeah.
And it's not, it's not, especially when you lose somebody so tragically and unexpectedly. It's not a normal thing, and you're expected to go back to work. You're expected to continue what you're doing in life, and it's like, no, it does shake your world and rock your world. But I am thankful to say, through my faith, through family, through friends, through my community, I was able to continue to move forward, not move on, move forward.
I love that. Yep.
And thrive because of that. But again, journey and healing is a process. So I'm still figuring it out as I go.
And it's really hard to change things if you can't talk about them.
Absolutely. Absolutely.
So I love that you're talking about it, and I'm really honored that you chose this forum as a place to bring it up. So thank you for that so much. I know you had an example of courage in your professional life as well. I'd love to hear about that too.
Yeah, so professionally, and this is more recent, stepping out of my comfort zone and stepping into my calling, right? So I recently experienced a job loss. I was working at the federal government and like most folks are experiencing a lot of job loss. So
Yep.
I can definitely resonate to that, who are navigating that as well. And it was back in March. My contract ended and I was on the team for about 5 years at CDC, actually. Loved the job, loved my team, loved the work that we did. And I was actually at a point where I was like, I think I'm just going to stay here and do my thing. It was just, I was really feeling more confident and comfortable in the work that I was doing and the projects I was leading. It was around heart disease and stroke prevention and doing evaluation and research work around that and providing technical assistance to state and local health departments. And I was just like, this is great. I'm going to stay here and then do my consulting business on the side. And initially I was supposed to fully launch last year, but got so comfortable with the job.
Yeah.
It was great, and then I got to a point where I was just like, yeah, we're going to stick with this and we'll figure out the consulting sometime when I got time. It's going to get done. Sure enough, when life happens, lifes, and the rug gets pulled under you. And I've had nudges throughout, I want to say the year and a half since initially we did that workshop, the public health entrepreneurship. Shout out to Dr. Huntley.
Yes, shout out to Dr. Huntley.
Shout out to her. That helped propel me to get things on paper. It was a year and a half since then. And I was just like, I'm going to do it when I can. And then this particular job loss in March was like, whoa, I'm going to have to figure out my next steps. I have no choice. I've had nudges over the years of like, you need to do this, you need that. But I'm like, oh, no, I have time. And it was like, nope, now you got all the time.
Yeah, exactly.
Now you got all the time because you went unemployed. You need to figure stuff out.
Yes.
So now that I had all the time, I was like, okay, I had to do some self-reflecting figuring out, going back to my why.
Yes.
Figuring out my identity, because for me, I have to be honest, I think my identity was in my job for sure. I was like, I work at CDC, I'm a public health scientist, you know, I've been working here, I have this great job, great benefits, yada, yada, yada. You know, my identity was in that. And then also, like, who do I put my trust in? Or am I putting my trust in a government check? Because that job, as great as it was, great as the team was, no bad feelings, I still keep in touch with them.
Nice.
It was a resource and an opportunity, but not my end all be all, right?
Yeah.
And I had to really do some self-reflecting and think about my why and the vision God had initially given me, which was Women Impacting Nations Consulting, which was honestly 3 years ago.
Yeah.
So this has been years in the making, that he gave me the name, gave me the idea, gave me the vision, gave me the rooted of why in doing this. And I had to get back to that and execute it, make it happen. So I went from being in my comfort zone to like, I'm going to step into my calling, because I know this is a calling. This is more than just a business for me. This is my ministry and this is my legacy, right? And I'm not doing this just for money, because I chase purpose. I don't chase paper. I don't chase titles, and I don't chase accolades, right? So that is something that I discovered in this last couple of months of like pivoting from an employee mindset into an entrepreneur mindset, and really walking into the vision God has given me, you know, and moving from self-doubt too, because another thing that I was struggling with, it was like, am I truly an expert? Do I have what it takes to do this? You know? And I had to be like, yes, you do, sis. You do. You've been doing the thing for years. You've led projects. You've had so many experience from community level to federal to state to county. You know, you started out in the community as a community health worker, so you have the community aspect, to now, you know, using data and numbers to tell the story. You have a passion to serve. You have a passion to help people. You have life experiences outside of professional, personally, to be able to speak to this. So you are the expert and you are ready to do this. And God will provide the resources, the clients, and the right contracts to do it and to execute it, as long as I take the step. As long as I take the step. And I'm a firm believer, and I have seen it tangible in my life this last couple of months, that provision always follows purpose. Provision always follows purpose. So as long as you're chasing the purpose, the provision will follow. So I'm not worried about my finances as I used to before, because before I'd be like, oh my gosh, you know, it's all going to be covered. The resources, the right people, the right connections, the right open doors will come, and it has come since I started to fully walk in my calling.
Yeah.
Yes.
So proud of you.
Thank you. Thank you.
Yeah. I'm just going to like take a breath into like, you are the expert. I love that you're leaning into that. And I think that's really hard for a lot of people, is to think of ourselves as the expert. And yes, like, we have expertise, like claim that title. I am an expert, you know?
Yeah.
I mean, I had the same like worries about even starting the podcast. It's like, do I know enough to do this? Am I good enough at my job? Am I, yeah. And it's like, you know what? We get to claim our expertise.
Absolutely. Absolutely. Another thing I want to add to that, also claiming that we are unique people and we're multifaceted.
Yes.
That is something that I've been learning these past couple of months. Like, I used to put myself in like this one lane or box. I was like, okay, government, consulting, community work is here, right? And it's like, no, all these things can overlap and you can do many things. You don't have to be in one lane. And you know, sometimes you hear these quotes about stay in your lane. No, you do not have to stay in your lane. You could be multiple lanes. Not while you're driving, though, because that's not safe.
Yeah, that's public health. Stay in your lane when you're driving.
Yeah, especially in Atlanta with Atlanta traffic. You don't want to be in multiple lanes. But as far as when it comes to your career and your calling and your goals and the vision you have, you can do multiple things. You can be multifaceted.
Yeah, this is, to me, this is the like take up the space, you know, like Yes. we get to take up space and bring all of ourselves, all the different parts of ourselves, and all the different lanes. Yes.
Yes.
Love it. Okay. Well, I wanted to also ask you about this idea of claiming and expressing your power, especially in spaces that may not always welcome it. And, I'm curious about how you express and embody your power as a Black woman doing the work of public health.
Okay. Yeah, that is a great question. How do I express my power? So first and foremost, I think we have to realize power, especially for a Black woman, does not have to equal being exhausted and burnout.
Oh, yeah.
Because we think sometimes you gotta, be of excellence and execute and do all these things and grind and prove to people that you're supposed to be at the table, you're supposed to be in this space, and you're supposed to have this job and this title and these degrees. And you go to school to get all these degrees just to prove that you're adequate. No, I don't operate from that mindset anymore. I used to. I used to just be happy to be at the table. Now I create spaces and I create the table for myself, right? Because I just, I've gone through so much and learned so much to have that mindset shift for me, right? So power doesn't have to equal exhaustion and burnout. For me personally, I've experienced burnout for like the first time last year, actually, right after we did our workshop. I remember specifically. And it wasn't the workshop, it was life and work and all these things that just hit me at once. And I ended up having to take a sabbatical. I call it a sabbatical. It wasn't really that long, but for me, it was long enough because to give you a backstory of how I operate, I'm a go getter, right? I don't take time off much. I'm like, I do something and I'm like, okay, that's cool. Let me get to the next. When I accomplish something or I master something, I'm like, okay, I'm bored. Let's go. I'm always involved in stuff in organizations, church, serving. Like I'm just a mover and shaker. And that's just how I've always been. You can ask my parents. So that's just my quality in me. But there's a downfall to that. It's a great trait to have, but if you don't use it with wisdom, it can be something that causes burnout, right? Yeah. It can cause stress and it can cause fatigue, right? And we all know how stress and fatigue can cause illnesses, and just being adamant of that, being as a public health professional, recognizing that. So for me, I experienced my first for real, like complete burnout last year of March, and I had to take a month off of work for the first time in like 15 years. Yeah. First time taking time off. And I also want to say, being a person that's a mover and shaker that doesn't take time off, that's not a flex. That is not a flex at all. And I used to think, oh my gosh, me moving and doing all this stuff and being busybody, I'm just doing a thing. No, it's not. I'm at a space in my life, I want to create a life I don't need a vacation from. All right?
Oh, yes.
That is where I'm at.
That like deserves some snaps. That's awesome.
Snaps. I am creating a life I don't need a vacation from. So how I show power is prioritizing my wellness, my holistic wellness, physically, emotionally, mentally, spiritually, financially, relationally. With any job that I take, with any contract that I take, with any client that I take, I have to make sure that it aligns with my wellness. So making sure that there's flexibility in my schedule. With my time, financially, I'm able to cover my needs, right? My mental health is good, right? I'm carving out space to take walks. I'm carving out space to get therapy, to talking to folks, talking to my community. I have autonomy in my work. I don't want to just take on any project just because. Yep. Does it align with the mission and values of Win Consulting? If it doesn't, then I'm sorry. We can't work together, and we're gonna have to be okay with that.
Yeah.
So just making sure things are aligned to where I'm at currently in the season of my life is how I show up and have power. Making sure that I'm more in control of my well-being.
Yeah, I mean, what I feel like you're talking about vision, right? It's like you want to do things that are aligned with your vision for your life. And opportunities may come, but if they're not aligned with your vision, then they're not the right opportunities.
They're not.
And I think that's challenging. That like can be really challenging for people to feel like it's okay to say that, to feel like it's okay to say no to something that doesn't move you towards where you want to go.
Absolutely. Yeah. Absolutely. And I think the last thing I want to say about that particular question, which I think is a great question, is of like expecting more and thinking bigger when it comes to your career and calling. Like, so my initial dream, I brought up government. Like I remember being back in grad school back in 2015, I said, I'm going to move to Atlanta and work for CDC. I don't know where that came from, but I was telling everybody that, and everybody's like, okay, Simone, like that's your dream. And I'm like, yeah, that's what I'm going to do. And it took years to get there, but it eventually did happen. And then when I finally got to that quote unquote dream, I was like, but wait, there's more, you know? And being okay to pivot from that initial dream and goal, to be okay to shift. And I think that takes courage and power too. Like sometimes you might write things down and that might have been the goal 5 years ago, but things in life change, your views change, what's important to you changes, and being okay to know that you can expect more and think bigger. So now the dream and goal for me is consulting, but knowing that consulting is just the avenue too. It's bigger than that. That is the avenue to help people, to make impact, to empower people. And we'll definitely talk more about that, probably more in just the vision for the future.
You're revising your vision. Sometimes you realize that something isn't part of your vision anymore. You thought it was, and it's not, and you get to take it off. I go back to my list. I talked about this in the first episode, which is sort of my like, why am I doing this solo episode, and about having like a list of desires, which is related to like what is my vision, and that I get to go. Sometimes I look at the list and I'm like, I don't actually want to do this anymore. I don't want this. This is not what I want, and so I get to cross it off. And then sometimes I go and I'm like, I did this. And I get to cross it off, and then I get to add new things. So yes. Oh, yes. Love it.
Yeah.
You get to revise. And I mean, that's life, right?
That is life. And I know for me, like I had struggled with that over the years, because I'm like, I have to check this off. I said I'm going to do it, especially when you start telling people too. It's like, you feel like you have this obligation to like, I don't want to fail. I don't want people think I'm like scatterbrained and like all over the place.
Yeah.
Like, I said I was going to do this, I'm going to do it. And it's like, no, you don't owe anybody nothing. You're right. You have the space to change your mind.
Yeah. Yeah. I think like it's really, for me, it's been really important to differentiate my vision and like the things that I want in my life from a to-do list, because
that part.
I'm so comfortable making to-do lists. I could sit and make to-do lists all day, every day.
Here, guilty.
You know, it's like, that's actually different than my vision. So let's talk about vision. I want to hear your vision for the future. I want to hear, what is your vision for public health? What is your vision for your communities? How do you see Black women shaping these futures, this vision? And then, of course, I want to end on your personal vision for yourself, your vision for your own future.
Awesome. Yeah. So vision for communities.
Yeah.
I want to see communities win. I want to see all communities win. I want to see Black and brown communities win. I want to see the use of health information and data and stories of people to actually create solutions of the issues that we see, the health disparities that we see, the health inequities that we see, the things that we talk about all the time, that we've been talking about for years, social determinants of health, social support needs. Like, we know this, we've read this, we study this, we see this in our work, but how can we make the change? I want to see changes in maternal health and chronic disease. when it comes down to these systems in healthcare and barriers to care and these policies, health insurance coverage, like ensuring people are able to get the optimal care that they deserve and are entitled to, right? Competent care, culturally competent care. I want to see and hear more stories of what is working and less about what's not.
Oh, yes.
I'm tired of hearing this. I mean, okay, let me be mindful. I think those stories are very important.
Yes.
But I want to hear more of what's working, how
Yes.
X, Y, and Z program, strategy, and policy, or even a treatment is helping Black and Brown communities, so that those particular stories can be replicated. Because I don't
Turn
want
up
to
the
replicate
volume on what's working. Yeah.
Thank you. Why replicate what's not working? We already know it's not working. Let's replicate what is working and finding ways to make positive change in communities. Like, I'm just really tired of talking about the same things. I really am. And just want to be in spaces around like-minded people who want to truly want to see transformation in their communities. Because again, going back to earlier, we are part of the community. We all have a story. We all been impacted by some shape or form in public health. I've dealt with feeling unheard. I've dealt with feeling like I've been misdiagnosed. I've dealt with having to see a second or third opinion. I've also dealt with having to make sure I find a Black doctor because I feel like that's the only way I'm going to be heard, you know? I have been that person that comes with my pen and paper and ready to ask questions. They hate to see me come in at a doctor's office. They hate to see me come in at a hospital, especially when I go with my family, because I am that person that's like asking questions left and right, because I've experienced with my brother, you know, passing away, unfortunately, due to medical negligence. So that has impacted me. I know what it feels like to have medical mistrust and trauma, right? Of going to a doctor and feeling anxious about it because what if this leads to something, you know, because of that. So I'm just ready to see change. And I know it might kind of sound cliche, but I truly definitely want to see change and be part of the movement and be part of the boots and ground. Like, less about just carving out these reports and having it sit on a shelf and dust up and be 100 pages. And like, no, what is meaningful? What does this mean? And how can we create change? And who needs to be in the room to discuss this? And not just, you know, the usual folks. What about the non-traditional folks, our community health workers, our people in the community, the church, faith-based communities, you know, philanthropists, right? You know, people part of our foundations, you know, like, yes, let's talk about it. Let's do something about it. And let's replicate the solutions that are working.
Yep. Yeah, absolutely. Absolutely. So Simone, what is your personal vision? What's next for you?
Yes, I'm glad you asked.
Personally, professionally, whatever. Yeah.
Yes. So going back to earlier, we were discussing about how vision can change. So I want to, you know, put that caveat there. Like, this is what I'm thinking now, but that it could definitely change. So don't hold me to this. But through Women Impacting Nations Consulting, when consulting, a part of that leg of my business and consulting firm, again, I mentioned earlier, my business is more than just evaluation research. It's about building legacy. It's about ministry as well. So I want to empower women of color to lead in boldness in public health spaces. Just as these like conversations like this, I want more of those, you know? I want to use their voices to be amplified in our communities, right? For them to use their God-given gifts and talents to emancipate greatness and to be the folks that create solutions. Not just talk about our issues, but create the solutions. So overall, I have a vision of championing women leadership among minority populations, specifically women. That's why it's called Women Impacting Nations for a reason. It's very intentional. And build public health innovation and impact. So like using these women's talents and gifts and like calling it out, so that empowering them to use their creativity, whether it's in content creation, whether it's in social media, whether it's in tech, like the non-traditional avenues, not doing the same thing that we've done, but pushing those non-traditional avenues to help build public health messaging that's culturally competent, as well as to create those solutions to make change.
Yeah, Simone, so I wanted to make sure that our listeners know the best way to connect with you, to learn more about you and also more about your courage. What's the best way?
Thank you. So as far as reaching out to me, I would say the best way is LinkedIn. I am trying to be more intentional about being active on there. So you can look me up on LinkedIn at Simone McPherson. I also have my business page on there, my consulting firm. It is Women Impacting Nations Consulting, also known as WIN. And another space to connect with me is on Instagram. I am looking forward to creating more content, talking about issues, talking about all things evaluation and data, how to apply that to real life and make it more relatable to folks. Because a lot of people are like, what is evaluation, right? Like, what does that mean? And that will be on Instagram. Like I mentioned, it is w.i.n Consulting LLC. So WIN Consulting LLC.
And I will make sure that all of those links go in the show notes. So it'll be easy for people to connect with you.
Yes, thank you.
Awesome. Thank you so much. This has been fantastic. And just a lot of vulnerability from you. And I really appreciate that. Yeah. I didn't expect anything. I mean, you know, I didn't expect anything less from you, but I just want to say that I appreciate your vulnerability and and exciting things to come.
Very much so. And I want to thank you for even creating the space for me to be vulnerable and feel comfortable and safe in doing that. Because again, I told you earlier, like, I don't talk about this much. So thank you for being part of my healing journey.
Oh my gosh, you are so welcome. Yeah. It is my absolute pleasure. Okay, well, we'll be in touch. Sooner than a year and a half.
Yes, for sure.
Sometimes courage is sharing your story for the very first time. Sometimes courage is finding purpose in the middle of heartbreak. Sometimes courage is choosing rest and wellness in a world that glorifies exhaustion. Simone McPherson reminds us that courage can look like grieving honestly, leading boldly, and building spaces where women of color can rise, heal, and transform public health and themselves from the inside out. You can connect with Simone on LinkedIn to learn more about her and her courage. All the links to connect with her are on our show notes page for this episode, located on our website, courageouspublichealth.com, under episode 20. Before you return to your day, take a minute to sign up for the weekly Courageous Public Health podcast email updates so you never miss an episode. You can do that on our website at courageouspublichealth.com because there's so much more great stuff to come. Thanks for being here, and until our next episode, stay courageous. Thank you for listening to the Courageous Public Health podcast. Visit courageouspublichealth.com to find the show notes for each episode and learn how to connect with us.